Yeah, so I purely do spine surgery, mainly neck and low back. Most spine surgery in general is arthritis. And so I see here in Naperville a lot of golfers because arthritis happens to everybody, and pretty much everybody in Naperville golfs. So most of my practice is just taking care of nerves being pinched and bones moving out of place in the neck and low back. You know, I was lucky enough, I was blessed, played a lot of baseball. I grew up in Arizona and had a great experience playing baseball, was able to play at the University of Notre Dame. And during my time there, I actually had a stress fracture in my low back and a slip of the bone. Because of that, I ended up having surgery. And so at 19 years old, I had a spinal fusion. And I realized at that time and moving forward that working with athletes was something I think I wanted to do, along with potentially spine surgery, and it really actually drove me towards my professional career now. The issue with discs is they love compression, but they don't love torsions, and baseball and golfing requires high velocity, torsion on the spine. And so it's very common for people who are golfers to have disc issues. Most commonly at L4-5 and L5S1, which is in the lower part of your lumbar spine, or in the neck. So the torsion is what people don't like. And if you think of your neck, how much rotation you have during a golf swing, and couple that with most golfers, you have elite golfers who are 20 years old, but then the most golfers, golf until they're 60, 70, and 80, and you're asking a 70-year-old arthritic spine to still perform a high velocity exercise. Most important thing is most people don't need surgery. I think people are scared to hear that they have spine surgery. Spine surgery can have a bad stigma with it, and they're like, oh my gosh, I'm gonna have spine surgery. Most of the time they don't need it. We have a great opportunity here at Midwest Orthopaedics. We have physical trainers and people who work with athletes all the time to help them get back to sport without surgery. There's always injections. There's so many different types of treatment now that we can have outside of just performing yoga or getting that on a daily basis. I think second, it's always good to get evaluated because there are times when people have issues, especially in the neck, they don't realize could be worse than they're realizing, or if they're feeling symptoms on a daily basis, or feel like their arms are weak or their legs are weak. It's always good to get that evaluated and just checked out to make sure nothing worse is happening. So I think the two most important things to avoid injuries. One is doing something on a daily basis or a weekly basis. What I found since I had a prior lumbar fusion is how to prevent myself from injuring my back or having just daily back pain. Most people I operate on, that are athletes have pain playing their sport, but they also have pain just doing normal daily activities, walking around, jogging, so they have pain all the time. What I found is performing something that has some sort of a spine exercise, strengthening as well as stretching on a daily basis helps. And what I found was like 15 minutes of yoga in the morning when you wake up. It's an easy thing to do. In today's COVID era, I don't want people to go to a class. You don't have to go to a class to do this. I actually have never been to a yoga class, but I've done hundreds of yoga workouts because I wake up 15 minutes before I had to, and just do a quick workout for yoga 15 minutes, and then I feel ready to go for the day. So I think doing something daily, or at least at a high volume on a weekly basis, is good. In terms of the day of, there are a couple of things. Is one, John Daly, you can just kind of show up and go swing as hard as you can. That's how you play golf. That's caused people to think that that's okay. But also, we live busy lives now. You have work, you have kids, and it's very common to show up and like, oh, my friends are waiting for me. I got to get there as fast as I can. Just make sure you give yourself time to warm up. So whether it's a little jog and a stretch, which is like never really seen on a golf course, but just because you don't show up in time to hit golf balls on the driving range, don't feel like you have to take a powerful swing on the first hole. Make sure you take some practice swings, somehow warm your spine up, because you're asking it to do a lot. And even taking 5 extra minutes to warm up can help save the rest of the season, because if you injure yourself, I can tell you it can take a few months to be able to recover from it.